Hi guys, so in today's lecture we will talk about tuberculosis. In tuberculosis we particularly talk about mild grade fever with evening rise. Why this evening rise? This evening rise is not because the bacteria becomes romantic in evening hours. This evening rise is in fact due to physiological variation of body temperature during morning and evening hours. In evening hours temperature is higher as compared to morning hours, and this bacterial infection adds few degrees to already increased temperature during evening hours, resulting into subjective feeling of fever, particularly during the evening hours. Now, let's also talk about in brief about the extrapulmonary tuberculosis. I did talk that extrapulmonary tuberculosis happens due to spread of this Mycobacterium tuberculosis bacteria hematogenously, that is via blood, not via lymphatics. And we did discuss that most common site for extrapulmonary tuberculosis is your lymph node, mainly resulting into cervical lymphadenitis, and this particular structure is also known as scrofula. And what is the second most common site? That is your pleura, resulting into pleural tuberculosis. Try to appreciate few types of extrapulmonary tuberculosis. Here you can appreciate intestinal tuberculosis, also known as Cox abdomen, and this can be primary, secondary or hyperplastic. Let's not go into that detail. What is most common site of your intestinal tuberculosis? It is your terminal ileum. Now let's also talk about a dreaded form of TB that results into TB of CNS, that results into tubercular meningitis. So it can cause tubercular meningitis, but sometimes it can also result into intracranial space occupying lesion by the name of tuberculoma. Okay. Now it can also affect your kidneys, that is urogenital system, and kidney might become very hard, also known as putty kidney or cement kidney. Now, it can also involve your adrenal glands, resulting into hyposecretion of adrenal hormones. Bone involvement can either be in form of osteomyelitis, or it can also involve your vertebrae, resulting into Pott's disease, also known as Pott's spine, presenting mainly in form of gibbous and weakness in bilateral lower limbs. Now, the most common site of spine involvement happens to be your lumbar vertebrae. It can also cause TB of the reproductive organs, particularly fallopian tubes, resulting into salpingitis, and it might lead to infertility. Okay.